It actually was not the health department's recommendation to close the school. Orchard Park independently decided to close the school to provide aggressive disinfectant. But we actually never recommend for those situations to close the school. I mean, kids are contagious several days before the onset of symptoms and then the first few days during symptoms. So if you just close the school for one day, nobody's exposed for that one day, but then when they return to school, they can continue getting exposed. So what we recommend is to keep the school open. Kids need to go to school, and then just make sure that they clean down all the classrooms and all the areas where the students frequent after school.
Hey, doctor, is norovirus something that's really contagious, say, if you're playing sports with another school?
Well, it's really something that is what we call virus that's transmitted through a route we call fecal-oral transmission. So, again, it's on people's hands, or sometimes if they vomit, it can be on in the bathroom. So again, it's usually through hand contact with somebody who's been ill and has either, touched their mouth or not washed their hands after they've gone to the bathroom.
Doctor, you mentioned that the health department in this situation did not actually close the school, but what type of situations does the health department come in to maybe to order a close down?
Well, it would be a very rare event, maybe perhaps an outbreak of a very dangerous disease. But in this situation, norovirus is usually presents with some mild gastrointestinal symptoms. Kids may have some nauseousness, vomiting, diarrhea. I mean, they could get dehydrated if they don't keep up with their fluids. But again, it usually doesn't require hospitalization in an otherwise healthy preteen or teen.
Dr. Gale Burstein, the Commissioner of Health for the Erie County Health Department, thanks for getting back to us and clarifying that situation.
Sure, but I just want to remind all your listeners that again, whether they go to Orchard Park or if their kids go to any other school, it's still so important to wash your hands. Especially before they eat, and especially after they go to the bathroom or have touched doorknobs or shaken hands with other kids. It's just you can't wash your hands enough. And I know in a school situation, it can be difficult to get to the bathroom when just to wash your hands. So hopefully schools have available in all the classrooms and in the halls hand sanitizers. That's the next best. And if they don't, it'd be great if parents could pack some little hand sanitizer with their kids to take to school. But washing your hands is really the best way to prevent that type of infection.
Good advice. Thanks so much for calling back.
Okay, thank you. Take care.